Welcome to the very first episode of the Wealth and Wealth podcast. This is a safe space where we discuss health, wellness, and everything that has to do with our well-being. In this podcast, we believe that health is wealth, and there are some life choices that can impact your well-being. I was listening to a podcast last week where someone mentioned that you're just one diagnosis from being broke, and that really struck me. On this episode, we're going to be discussing about a very sensitive topic, and I am not alone. I am with a guest. Her name is Patra Ezeamii. Patra is a doctoral student of public health and specialized in epidemiology. She's well grounded in research, and her research interest is disease prevention and public health communication. Hi, Patra. How are you?
I'm doing very well. Hi, Ebere. Thank you so much for having me.
You're welcome. Thank you for also agreeing to be here and doing this with me. I really appreciate it. Today, we're going to be talking about PCOS, and I know it's a very sensitive topic and it has gained traction over a couple of years now. However, with the whole sensitivity that is going on, people are still getting very wrong information, and there are so many misconceptions about PCOS. So I want us to dig into that today and just enlighten the public as much as we can. Going into it, I want you to tell me about PCOS. What is PCOS for a young teenager? Tell me about PCOS.
Basically, I would say PCOS is a hormonal imbalance disorder which affects women of reproductive age. When we say reproductive age, you are basically looking at women from 18 years and above. And this disorder is not very well diagnosed. Some individuals who present some symptoms that are very well known to be related to PCOS are not very well diagnosed because most often they are being dismissed. But according to the World Health Organization, about 10 to 13% of women globally have PCOS. It's a very serious health condition that needs to be discussed.
Thank you so much, Patra. I actually have seen where people say, probably because I'm overweight, I have facial hairs, or one or two things is happening, I have PCOS. And I'm like, I don't think you just come about the diagnosis of PCOS just because of that. So how do we diagnose PCOS?
Before I get to diagnosis, I would still want to say something that PCOS is actually, again, a complex endocrine and a metabolic disorder. We are both looking at endocrine and metabolic. It's beyond just one thing. And recently, the acronym has been changed to PMOS, which is polyendocrine metabolic disorder. That is a better acronym to very well capture what exactly is going on. Because when we hear polycystic ovarian disorder, it's just as if, oh, something was going on only with the ovaries, but it transcends beyond what is going on with the ovaries. Something is also going on with the hormones. We look at things around hormonal imbalance, like insulin and androgen levels. Androgen is actually an important hormone that even a woman should have. But then the problem is when the level of this hormone is actually very high, beyond normal. And also insulin resistance. Back to your question. First thing is that we notice some symptoms, things around facial hairs, things around depression, anxiety, things around irregular menstruation or inconsistent ovulation, things around weight gain as well, or even sleep disorders. These are the symptoms that, first of all, a person would have before they start to consider that. But even with these symptoms, it does not necessarily mean that you have PCOS. You first of all have to discuss with your primary care provider, and you share your symptoms with them. Even they themselves, with your symptoms alone, will not do the diagnosis. They still have to do some blood work. The blood work will help to look at the androgen and insulin level to be able to tell if it's higher than normal. And as well, most times some people are also even asked to do ultrasound imaging, that we look at the ovaries and see if there are cysts. This cyst is not like the actual cyst that we know anyways, to look at if there are immature follicles or basically immature eggs around the ovaries that is leading to this condition. It's not just something that you have symptoms and next thing you're being diagnosed. There are still other processes that are involved.
Thank you for shedding more light into that. The next question I have is, I've seen people say, oh, I can't get pregnant because I have PCOS, and there have been so many myths around PCOS, and one of them is pregnancy, which is one of the vital function of a woman. Does it mean that because a person has PCOS, they can get pregnant, or can they actually get pregnant?
I understand the fear around getting pregnant and PCOS because, like I previously mentioned, there are issues around irregularities of ovulation, and we understand that you need to ovulate to be able to conceive. Without ovulation, the chances of conception is minimal. But at the same time, irregular ovulation does not necessarily mean that there is no ovulation at all. You can still be ovulating. Basically, that again does not mean that if you have irregular ovulation, then you would not be able to get pregnant. There are so many women who have PCOS who have still been able to get pregnant. It just has to do with so many factors that we may be discussing later to be considered beyond just, oh, I have this and therefore I cannot get pregnant. There are researches that have proven that women are still able to get pregnant with their PCOS.
Thank you. I also want to talk about another myth. So when someone said eating less and exercising more is going to fix it, how is that true? What does research have to say about it?
According to research, eating less and exercising more are both very effective in terms of the body metabolism, but that is not the only thing to consider. There are other things to consider. Eating less and exercising more may help you to control insulin resistance, because eating less, for instance, may be consuming food with low glycemic index, and when you consume food with low glycemic index, you will not have a lot to fight with insulin resistance. But at the same time, that is not all it takes. It transcends. That's why I said initially it is a complex endocrine and metabolic disorder. Is not just focusing on metabolism. There is also the endocrine aspect of it to consider. So it may help you, but that does not completely fix the problem.
All right. Thank you for that. Moving forward, we're going to be looking at treatment and management of PCOS. Someone asks, what really works when you talk about PCOS? What can you recommend?
Now, thank you for that question. According to research, I would want to say that PCOS demands a multidisciplinary care. Okay. So it's just beyond the place of a clinician, right? Help manage that process. For instance, let's say we have an endocrinologist, we also have a gynecologist. You can work with these two people, but still not be able to use maximum healthcare, because we also have the mental health aspect of PCOS to think about. Some women are not just okay with what their body looks like, right? Also have some women who feel depressed. Some people are very anxious. Oh, I'm going to get pregnant, just like you asked me. Some women are like, oh, I'm never going to get pregnant. And that can even lead them to depression. So when it comes to the treatment for PCOS, there are many things. It's not just one thing, right? We need the gynecologist on board to be able to check our reproductive system. We need the endocrinologist on board to be able to look at our hormonal levels. We need the mental health professional on board to be able to take care of things like depression, anxiety, sleep disorders, and all of those things. We also need a dietitian to be able to say, structure your diet in these are things you should eat and these are things you should not eat. So basically, it all hands on deck kind of disorder. That's why I call it complex. Everybody needs to come on board to see that this patient is getting maximum care. And something I did not mention is that the PCOS varies for every individual. If one person experiences does not necessarily mean that it's the same thing another person will experience. Right. By saying that, again, it brings us back to saying that all hands must be on deck. Whether that be the gynecologist, the endocrinologist, the mental health professional, the nutritionist, everybody is important and is needed in situations like this, because you might, for instance, be taking medical advice from your doctor, don't do this, take this medication. At the end of the day, you're still having to battle with anxiety and depression. And even with the anxiety and depression, it might even limit how much you're able to care to whatever your doctor is telling you. That's why you still need a mental health support to be able to control, put everything in check and get the maximum health care that you deserve.
What I'm getting from this is that PCOS is a complex medical condition and it needs multifaceted. So everybody needs to be on board when treating this patient. It doesn't just have to do with, oh, I have PCOS, I shouldn't do this, I shouldn't do that. We should also look at other dynamics of our lives that PCOS is affecting, that people don't really talk about, like the mental health you talked about. You mentioned about nutrition, dietitian, and I've seen a lot of supplements on the internet. What do you have to say about this supplements and PCOS?
I would want to say that using supplements can be helpful, but supplement is not medical care. So the first step to PCOS is seek medical care. Supplement is more like an add-on, but it's not the main thing that you need to be able to handle PCOS. And before you even take any supplement, please discuss with your healthcare provider. Don't just go about like, oh, is this supplement that it's working, and then you jump on different things. You never know. Those two supplements might be contradicting in whatever they are doing to your system. So you might even end up even damaging yourself. So first things first, supplement is not healthcare. If you find out about any supplement, please discuss with your specialist or your healthcare provider, whoever it is that you seek medical advice from. Discuss with them, share these things with them, and obtain their approval before you go ahead to take any supplements.
So I want to touch on the mental health aspect that you talked about with PCOS. Seeing a lot of women that are overweight, I'll be like, oh, PCOS did this to me, facial hair. And there's this thing that comes with not seeing your period. You feel like you're not a woman when you don't see your period. How do you address that mental health aspect? Or speaking to that woman, what are you going to tell her? Because she might be losing her self-esteem and feel like, oh, I'm not a woman, I don't belong into the society because I have this condition. What do you have to say to someone going through it right now?
I think the first thing I would want to say is that your condition does not define you. Right. Seek mental health support, talk to different people as long as they are mental health professionals or advocate. But one thing you should know is that, one, your condition does not define you, and your condition is not the end of your story. I've seen so many women battle PCOS, and at some point they were able to maintain their weight, from a place of overweight to normal weight. There are so many factors, there are so many things that you can do to be able to get back on track. PCOS is not the end of your life. PCOS does not define you as a person. If you are not happy with the weight gain and everything that comes with PCOS, please seek a nutritionist, a dietitian, and also seek mental health support. But that does not define you. That is not the end of life for you.
Also, especially for places with poor healthcare, sometimes these women that have these symptoms and wanting to know more about whatever is wrong with them, they get dismissed by their doctor saying, oh, you probably track your menses and track your menstrual flow. And they'll be like, oh, I'm feeling this, I have this. What will you tell to these women? Because they feel like they're not being heard. What advice do you have for these women?
Access to healthcare is actually very important, but sometimes you really can't tell your doctor what to say to you. But what I'm going to say on this is, speak to your doctor. If at any point you feel dismissed by your doctor, seek a specialist. It's important to discuss that with your doctor anyway. You can tell your doctor, thank you so much for whatever advice you're giving to me, but I think I want to seek a specialist at this point. I want to talk to a gynecologist. I want to talk to an endocrinologist. Could you refer one to me, right? Please be very vocal. This is your health, and know what you want for yourself. This is your health. You need to be very audacious about your own health, because the decisions you make today will determine how far you're able to control some things tomorrow. So start today. If there is anything you have noticed and you've discussed with your primary care provider and they are not giving you whatever that you need, be it the resources or the advice that you need, let them know that you are seeking for a specialist. You can even go ahead to talk to one. Don't just shut your mouth and be like, oh, my doctor said this, therefore that's what my doctor said. Your health is yours, so make a wise decision about that.
Thank you so much. That was really insightful. I know you mentioned that you used to be an ulcer patient, but because you changed your diet and you're eating right and you were able to fix that. So I want to talk about the place of nutrition in managing PCOS. What role does nutrition has to play in management of PCOS?
Thank you so much. So yes, I used to have ulcer, and then I had to restructure my diet and know how to eat the right things, when to even eat and what not to eat as well. Nutrition is a very big part of our total well-being. Is a very huge part of that, right? And previously I mentioned that PCOS has to do with hormonal imbalance, and the two hormones I discussed are androgen and insulin. Insulin is a very important hormone. So insulin resistance, when there is insulin resistance, this carbohydrate is not being digested, rather it accumulates. That's the thing. So the good thing with dieting is that you can be able to portion whatever class of food that you're eating. Eat carbohydrates in less quantity, increase protein, increase fruit. That does not mean that you should exclude any class of food from your diet. That's not necessarily what this dieting is about, because some people begin to starve themselves, right? Just to be able to achieve that body or that condition, to be able to break out of that condition. But then you don't exclude anything completely. You can eat food with low glycemic index, because if it has low glycemic index, then you're not really going to struggle so much with the insulin resistance issues. So just basically talk to a dietitian, let them write a meal plan for you, let them help them walk you through that process. You would still eat bits and pieces of literally everything, but the proportion now is what will change.
Thank you so much. Lastly, I just have one more question for you, and it has to do with exercise and exercise as a whole. What advice will you give to someone having PCOS? Because I know that most of the time they have bad days with mental health and all of that, and they'll be like, oh, I don't want to work out. First of all, what role do you think that exercise play in management of PCOS, and how do you talk to someone that has PCOS to continue exercising?
Yeah, I think exercise and diet, and I feel like they basically go hand in hand. They are very important to control, or rather to manage PCOS. So with exercise helps with mood, most importantly, right? So things around anxiety and depression, it helps. Again, for PCOS, if PCOS is not being treated or given the attention that it demands, there are issues around high levels of cholesterol. And from high levels of cholesterol, we can see increase in risk of cardiovascular diseases. And so again, this is where exercise comes in. So by exercising, you are basically burning down whatever it be, the fat, the cholesterol levels, and you're also increasing your mental health, because now you feel more good about yourself, you feel better, you're not just depressed and sitting at one place. So dieting and exercise basically go hand in hand, and they are very important in managing PCOS.
Wow, thank you for that. That was really insightful. I just want to say thank you. I'll be in the comment section, and if you have questions, please ask. If you want to send a DM, or if you need to speak to Patra, I will just reach out to me and I'll connect you to her. Patra, thank you so much for coming and gracing this occasion. I really appreciate it. And so that's it. I'll see you guys on the next episode of Wealth and Wealth Podcast. Have a nice one. Bye, guys.